My name is Dr. Hopp, Robert Hopp. I'm a dermatologist here in Kennewick, Washington at the Center for Excellence in Dermatology. And I've created a video list of informational videos for my patients, covering subjects all the way from shave biopsies to melanoma to sunscreens and everything in between. They're short, informational videos of what I tell my patients and their instructional drawings that I've included that I think help patients understand uh, the subject that's being talked about. So I would encourage you to take advantage of these.
This video is on punch biopsies. Punch biopsies are a very common procedure to perform in a dermatology office, and they're done to sample the skin. The advantage to punch biopsies is that they go down a little bit deeper into the skin, down into the dermis, to sample lesions that are underneath the epidermis. They generally require a suture or two to close, but are easy to perform and very quick and relatively painless. So the epidermis is the outer layer of skin, very thin like a piece of a paper, the dermis, and then the subcutaneous fat. So if there's a lesion or an area of interest that's down underneath the skin, let's say it's suspect it's a skin cancer like a basal cell carcinoma that grows underneath the epidermis, and you want to sample that, you would put some numbing in the skin. You can use a topical medicine beforehand to numb up the skin a little bit. You would inject the lidocaine into the area, and then that would numb up the area relatively quickly. At that point, you would take the punch biopsy, and it basically kind of looks like a leather punch. They come in different sizes, all the way from 2 millimeters to 12 millimeters, and you just pick out the size of the punch biopsy based on the size of the area that you're trying to remove. And so the punch biopsy basically comes down and can remove the entire lesion, leaving an area that looks something like that. And the specimen itself generally is cylindrical like that. The top, this being the epidermis up here. And then that's sent in for pathologies to look at underneath the microscope. And then the area here that is the result of removal is generally sutured. So in that case, what happens is you take some nylon suture, and you can use 1 or 2 or however many sutures you need, and you come in and suture that up and tie it together. That helps prevent any bleeding, also speeds up the wound healing, prevents infection. And there's your stitch on top of the skin that goes underneath the skin and then back up the little knot. And generally that's left in place depending on the area for 7 or 10 days and then removed. Generally you use a Band-Aid with a little bit of antibiotic ointment. Clean it once a day with some hydrogen peroxide, and then if you need some help with suture removal, come in and the medical assistant will remove it. If it's an area that's easily removed by anyone with experience with suture removal, it's a pretty easy thing to do. So that's a review of punch biopsies, very common way to sample lesions that are a little bit deeper in the skin and often performed in a dermatology office.